Singapore has identified 29 variant infections that are of concern. 7 are of the more infectious Indian strain. 5 are linked to Tan Tock Seng Hospital. That's one of the reasons why medical authorities say the cluster is larger than usual. Gwyneth Teo joins us from outside Tan Tock Seng Hospital. Now, Gwyneth, should we be concerned about these variants of the virus?
I mean, definitely globally, I think there's concern over more infectious types of the virus. In particular, 29 local cases have been linked to these variants, and in particular, 10 of them have been linked to what we call Indian variants of the virus. And 7 of those are of the B16172 type of the virus, and it's spread out over 3 clusters in Singapore, which the Health Ministry has updated today are genetically not linked. So there is one point of concern that these clusters are in a way not linked epidemiologically. One other point of concern is that 5 of these 7 cases are linked only to the Tan Tock Seng Hospital cluster, and as you said, that is one reason. The more infectious strain is one reason why this cluster now has 40 cases and is Singapore's largest active cluster of cases. However, the task force did say that they are looking into other possible reasons why the virus has spread so quickly within Tan Tock Seng Hospital, and in particular, one ward, Ward 9D.
But we did note that there was a clustering of cases really around one single ward, or 9D. And we are exploring the possibility that there are other local influences, particularly related to the ward, that may have also influenced to a super spreading event occurring, leading to these cases. So we are studying the possibility that there may be issues with the airflow and ventilation in the ward, among various other hypotheses that we're entertaining. So until the studies are complete, we will not be able to give a definitive response, but we are exploring all possibilities.
Well, the task force also gave an update on their contact tracing and testing efforts. They've tested all over 1,000 inpatients in the hospital, and so far they've all returned negative test results, which is definitely good news, and they will be embarking on a second round of testing. They're also testing 10,000 staff and will give the update when that's ready. Now, in order to help with the manpower, the Health Ministry has also asked other hospitals to send manpower to Tan Tock Seng Hospital to care for the patients there, and therefore they're also all hospitals are going to defer non-urgent surgeries and admissions, and also will shift to telemedicine and medical delivery, or rather medicine delivery services for more stable cases in order to consolidate resources to help Tan Tock Seng Hospital through this time.
Gwyneth, there have also been reports of staycations being cancelled by hotels supporting the current pandemic effort. What can you tell us?
One of those reasons is because healthcare workers, especially those at Tan Tock Seng Hospital, have requested for some help with accommodation to give their family members some peace of mind, so that after they leave the workplace, they can go to a hotel to stay and do not have to be too overly concerned about the safety of their family members, for instance. Although they did say that this is out of an abundance of caution, not because of any heightened risk to these healthcare workers or to their family members. However, the Health Ministry also did say that they have heard some cases of discrimination against healthcare workers, which concerns them.
There have been some reports we hear of healthcare workers being told that they're not welcome after their landlord found that they're working in Tan Tock Seng. And this is a concern for us because these workers are well, and they've committed a lot of time and energy to us looking after patients in Tan Tock Seng Hospital at this stage. So we endeavor also to support them.
Another reason why hotels are actually turning away some customers is also because of the lengthened 21-day stay-home notice period for travellers coming in from higher-risk countries, leading to higher occupancy in these hotels. And that's why they're also consolidating their resources and turning some people away.
All right, Mary, thanks for that. Gwyneth Teo reporting to us live from outside the Tan Tock Seng Hospital in Singapore.